Thank you.
Thank you, everyone. We'll begin with our next session, and we welcome our chief guest, our honorable chief guest, Karnataka Health Minister, Shri Dinesh Ji. Thank you so much, Dinesh Ji, for joining us in today's session and spreading awareness and a message of hope and resilience among all the cancer warriors. And we welcome you to this World Cancer Day 1 Lakh Lives Impact Campaign. Shri Dinesh Ji, current Health and Family Welfare Minister of Karnataka. He has been a 6-time member of Karnataka Legislative Assembly since 1999. He was previously President of the Karnataka Pradesh Congress Committee and was Minister of Food, Civil Supplies and Consumer Affairs in Karnataka. He has also laid down a roadmap for ending cervical cancer in Karnataka through accessible screening and treatment. One of his aims is to increase access to human papillomavirus screening and meeting the World Health Organization's cervical cancer elimination goal. He has been playing a transformative and innovating role in bringing about a heavy change in the way we see healthcare. I'm sure that under his esteemed leadership, we can see a healthier state with fewer cancer cases and hopefully in the future, zero cancer cases. Thank you so much, sir, for joining us today on this occasion of World Cancer Day. And I would like to invite you to share your words on this occasion for our fellow members who have been diagnosed with cancer or other members who are exploring what can we do so that we can live in a better community, a healthier community. Thank you so much for having joining us.
Yeah, thank you for inviting me on this program. And firstly, ZenOnco.io, which is doing wonderful work, voluntary wonderful work in cancer care and spreading awareness and inspiring a lot of people to come forward and to work together to see how we can tackle the prevalence of cancer and how we can mitigate it and how we can prevent it. So it's a very challenging task. And as we all know, the incidence of cancer is rising in the country today. And today, being the World Cancer, I think it is of great importance for a country like India, which has got huge population. And with the increase of cancer amongst our population, and how we can work towards preventing it, how we can work at early detection, and how we can work towards bringing better health care for our common people, for our poorer sections. These are big challenges for us, and Dimple ji and her team coming forward and doing this work and bringing people together and trying to see how we can improve the care and how we can bring in NGOs, bring in and give strength to survivors also, people who are beyond, giving strength to those people who are undergoing cancer, and how we can, it's both psychological and financial, and so much of social pressures a family goes through when someone is diagnosed with cancer. So I think it has to be a team effort. Policies of the government has also needs to evolve, and for us, our focus is to see how we can, for me as a health minister, my focus will be to see how we can try and detect. One is prevention, of course, that how we can improve our people's lifestyles, how they can lead a more active lifestyle, eat better, and be aware of what are the causes for cancer, and also to be able to for an early detection, how we can organize screening camps, how we can use technology to find out and so it really helps in cancer care because if we catch them at a later stage, then it becomes very, very difficult for a normal or average family to be able to bear the expenditures also. So we're looking at that, and of course, we've been trying to see how we're working on a program, how we can try and do screening of for women, especially breast cancers, cervical cancers, oral cancers, and how we can go to the rural areas and find out and check. And because people don't come forward to get themselves screened also. That's another challenge for us. So that is, we are working on that, and we're trying to come out with a mass screening drive in Karnataka for that. And also we hope that Government of India has, since last year, since couple of years, have been saying that we will come out with a mass vaccination program for the HPV vaccine for cervical cancer. And hopefully this year's budget also, they mentioned it. And this year it should roll out, so that at least if we start vaccinating, we can in fact work towards eradicating cervical cancer. So there's so many other new technologies available using artificial intelligence and screening mechanisms to screen for lung cancers, all those things. So we are working on that. So I think today's program, where they've called all people, survivors, doctors, practitioners, and health experts together, I think it's a very good thing. And I would like to tell Dimpleji that after this program gets over, we can come back to us, and uh, whatever feedback and whatever inputs that she can give us, definitely we will take it on board when we make our policies also. And I think her own story is an inspiring story. So I think it inspires other people, to do more for society and to contribute more. I think that is the biggest thing. And so definitely, as a government, we are giving all the best efforts, and we will continue to do so. So I want to wish this program all the best, and uh, hopefully your deliberations will lead to better outcomes for all of us, and for the society as a whole. Thank you, and all the very best.
Thank you. Thank you so much, Dinesh ji. It really means a lot hearing from you about the screening and the prevention and what all things as a society we can do together for a better community. And there's a lot of chats here where people are, Pratima ji is saying that it's very good to see Dinesh Gundu Rao sir here. Thank you for joining us and supporting the cause. And somebody has also written that we also need government support for psychological life, because we face a lot of psychological issues when we go through cancer, apart from the other issues that we share. And one more person has requested, Dinesh Gundu Rao sir, if we can have HPV vaccine from government for all the 18 plus years of age ladies as well, because it's been a very common cancer. And in India, every 8 minutes, one woman dies of cervical cancer. So really appreciate your kind words on that to spread more awareness, so that more and more people can be aware and also save their lives from cancer. And as we recently heard that prevention is better than cure. So if this vaccine and the government initiatives that you are taking, if we are able to prevent it, that's saving lives from cancer. So thank you so much, sir. If you have time, can we take one question? Thank you. Karnataka state is doing a lot of things in the field of cancer care. And according to you, what are the 1, 2, or 3 things that we should all do together to help us achieve our goal of less cancer cases in the state and in the country?
Yeah. So see, there are. It's a pronged issue, because cancer treatment is evolving. There's a lot of high-end treatments available, which is really out of reach of the common man. But we've got some premier cancer institutes, so we try to cater to as many patients as possible through our Kidwai Cancer Institute, which is there in Bangalore, and a few more other cities in Karnataka. And now we want to also be able to provide. We've got medical colleges across the state now. Almost 15 districts are medical colleges. So we want to increase so that these super specialties are being accommodated over there. And we also, at every district hospital, we want to give cancer care. At least basic cancer care can be brought to far off places, so that it becomes easily available. Other thing that we need to work is, as a society as a whole, how we can bring about basic changing in our lifestyles, changing in what the kind of foods we eat, and the kind of problems that we have due to obesity and bad habits. That's something that we need to really work hard on, because preventive care somehow doesn't get as much focus as curative care. That is, we can spend a lot of money on building hospitals and getting in equipment. At the same time, preventive care is somewhere I think we as a government and society as a whole, we need to all focus. And I think the biggest second way after prevention, and like I said earlier, is that we want to organize somehow. We want to use technology. We still don't have that right kind of technologies. Hopefully, they're getting better. How we can be able to screen our people more easily, screen our populations, so that we can identify and find out who are the most susceptible for cancer, and and to try and detect as early as possible. So this mass screening kind of a program, apart from vaccination, which is there just for cervical cancer, mass screening is, I think, the way forward. And for that, I think we're looking at better technologies and better ways of easier detection. So I think that is what these 2-3 things: preventive, more use new technologies to screen, and of course improve our care facilities, especially for people who go through a lot of psychological trauma, so that they can be able to talk to people and discuss. So these multiple things, that is what I think I would like to say that we as a government can focus on.
Definitely. Thank you so much, Dinesh ji, for sharing this, and we really thank you for taking your time out to come as a chief guest for this session. And after talking to you today, I'm confident that we all can work together to reduce cancer cases in the country. And the government of Karnataka is doing so much for us and is stressing so much importance of preventive care. And the government is investing so much in the latest technology so that all of us can screen ourselves faster and in a much cheaper, cost-effective, and a much easier and convenient way. And I'm sure, Shri Dinesh, under your leadership, we shall see a mass transformation in the cancer care space and a better quality of life for everyone. Thank you so much for
thank you very much. Thank you.